day, this is the outline of my presentation. Before we understand health security in relation to public safety, let us recall first the concept of human security in a broader concept. According to the Human Development Report 1994 by the United Nations Development Programme, human security has a broader scope from territorial security to the security of the people. It has two major components: freedom from fear, as defined as victory on the security front, and freedom from want, as defined as an outcome of victory on the social and economic front. This just simply means that we should not just put our focus on territorial integrity, but also on the security of the people. Human security is composed of 7 essential dimensions. Notably, health security is identified as one of the dimensions deeply intertwined with the other 6, namely economic, food, environmental, personal, community, and political. So what exactly does health security mean? The U.S. Centers for Disease Control and Prevention provides a more practical definition of health security, that is, the development of public health systems that prevent avoidable epidemics, detect threats early, and respond rapidly and effectively. It is about the protection of people and communities from infectious disease threats defined by the emergence and spread of new microbes, globalization of travel and trade, rise of drug resistance, and potential use of laboratories to make and release dangerous microbes, whether intentionally or not. Truly, healthier countries are more stable and prosperous. I salute those LGUs who give high regards to their health management system. This is one of the indicators of success of a community. Beyond biosafety, we have to also consider biosecurity. The United Nations Sustainable Development Goals call for global action to bring an end to the major causes of human insecurity, protect the planetary ecosystems, and ensure that all people enjoy the blessings of peace and prosperity by 2030. It should be noted that the pursuit of good health and well-being is clearly identified as one of the 17 Sustainable Development Goals. After having discussed health security in the broader context of human security, let us talk about the concept of public safety. According to the National Security Strategy 2018, public safety refers to the overall welfare and protection of the general public. This entails the integration of law enforcement, community policing, disaster management and resilience, and local governance in the security sector framework. This gives emphasis that there is a need for concerted effort of the different units to achieve public safety. The strategic objective is to maintain the concept of public safety in the context of national security agenda to build peaceful, safe, and resilient communities. The Philippine Public Safety College conceptualizes the so-called normative public safety system in the Philippines, which is about integrated and holistic pursuit of general welfare to ensure and sustain quality of life for all Filipinos. Within the public safety system, the starting point is leadership and governance, which ought to provide the strategic direction along with effective administration and sound management. Public safety professionals must invest heavily in capacity building and service delivery. The PPESC is in charge for the training of public safety professionals. The Bureau of Fire Protection, Philippine National Police, and the Philippine Coast Guard. Once these overarching objectives are effectively translated into policies, strategies, and PPAs, the following outcomes will be achieved: low casualty on health hazards, low prevalence of crimes, and high public satisfaction rating. These will then contribute largely in building safe and secure communities and eventually lead to improved peace and order. In effect, the values and principles of the population and the community will be upheld. The public safety system is derived from the domestic policy framework informed by the constitutional principles and policies of the state, as well as other laws of the land. Notably, we refer to the Republic Act 7160, Local Government Code of 1991, Section 16, General Welfare. The law explicitly states that every LGU shall exercise the powers for efficient and effective governance. This is also the same law that serves as main legal reference of DILG that guides its operations and interventions in the local government sector. Notably, promotion of health and safety is identified as one of the 9 goals under general welfare as shown. How then do we relate public safety with health security in light of COVID-19? Logically, if the government effectively mobilizes the nation to contain the pandemic and address the possible occurrence of crime, then people will attain freedom from fear and want. Conversely, if people live in disaster-resilient communities that prevent further spread of infectious diseases and enjoy sustainable human development, then the government is very much likely to see low possibility of occurrence of crime arising from economic disruption, societal dislocation, and/or breakdown of public order. 2. The current health security or public safety landscape. The World Economic Forum Global Risks Report 2020 identifies infectious diseases as one of the top 10 long-term risks by impact over the next 10 years. So why do we need to know the global risks reports? It is because these reports will be the basis of our direction in the planning against the COVID-19 or any other pandemic. Shown are the possible strategic implications if we fail to prevent and contain the spread of COVID-19. Shown is the table that specifically fleshes out the cause and effect implication of failure to prevent and contain COVID-19 at the strategic level using the PESTEL framework. We can observe that this pandemic has brought about inequality. For example, in the areas of training and education, those who have the capacity to purchase gadgets are more advantageous than those who have not.
How does the government, through IATF and NTF COVID-19, seek to prevent and contain the pandemic? Shown is a strategic framework against COVID-19. My co-lecturers will explain the framework in much more detail. This was the first strategic framework that was released by the National Task Force on COVID-19. Shown is the operational framework against COVID-19. As we are continuously learning about the virus, the IATF EID has released an updated operational framework versus COVID-19, which gives emphasis in the mainstreaming of the new normal. As previously presented, our strategy is national government-enabled, LGU-led, and people-centered. The reason behind the training on contact tracing is that we will be dealing with people. We have to ensure the engagement of the community members, as this is seen to be one of the keys to mitigate the spread of COVID-19. Lastly, and most importantly, allow me to discuss contact tracing as an indispensable tool against COVID-19. According to the Northampton Health Department, contact tracing is a fundamental part of outbreak control that is used by public health professionals around the world to prevent the spread of infections. This was the original definition of contact tracing, but since the virus is evolving, we need more encompassing definition of contact tracing. The process flow will be discussed by our speaker from the DOH. But I just want to focus on if we are successful in steps 1, 2, and 3. It will greatly contribute in the containment of the spread of COVID-19. As stated by Dr. Tedros Adhanom Ghebreyesus of the World Health Organization, no matter how bad the situation is, there is always hope. Contact tracers are the trained workers. In the barangay level, the contact tracers do the house-to-house for them to trace the cases and contacts. Communication about contact tracing should emphasize solidarity, reciprocity, and common good. This is in order for us to ensure the participation of the community in our fight against COVID-19. How then we are ought to contextualize contact tracing in the Philippines? Shown is the framework for expanded contact tracing efforts for COVID-19, as shared by Undersecretary Bernardo Florese Jr. Also shown are the latest figures on the current and future size of the contact tracing workforce under DILG. As part of the proposal of the DILG to date, the hiring and training of more contact tracers commenced. To break the stigma that the presence of uniformed personnel is not needed, it was the DILG that mandated the BFP and PNP to lend manpower to DOH for contact tracing. This is to effectively and efficiently perform contact tracing. Chief Galvez has reiterated that the engagement of police force in contact tracing is important as they have inquisitive and investigative skill. One of the applications that are being used in the contact tracing is the Geographic Information System, or GIS. We should keep in mind that all digital applications have security threats, but the DICT is directed to create safeguards to protect the information of the people in accordance with the Data Privacy Act of 2012. I just want to share with you the statement of Mayor Magalong. As presented by the LGA, we should always remember the secure guiding principles in contact tracing. To sum up, the PPSC has proposed this framework. As you can see, we have the operational framework, PDITR, and mainstream the new normal. And within this framework is the CT as one of the means to help detect individuals affected by COVID-19. In order to make our contact tracing efforts highly successful, we must remember the secure guiding principles, and these courses of actions are based on World Health Organization and Department of Health guidelines and grounded on the following virtues: courage, justice, temperance, wisdom, and empathy. Once we work together as one, we will achieve the following end result, which we consider as our long-term goal. Chain is broken, transmission is controlled, and impact to economy mitigated. Natural or human-induced disasters may lead to crises, crimes, conflicts, and catastrophe. But what we want to really avoid is chaos and anarchy. We have to be successful in fighting COVID-19 to avoid chaos and anarchy. The strategic significance of contact tracing cannot be overstated. One successfully identified, isolated, and treated COVID-positive person could break the chain of transmission to tens or hundreds of vulnerable people in the community. On the aggregate level, this will help save the economy and the government from collapse. We should find balance in the aspects of health, social, and economy for us to recover and be a resilient community. Let me end my presentation by quoting Secretary Eduardo M. Año. As shown in the slide, it is our ardent hope that with a holistic understanding of contact tracing within the nexus of public safety and health security, we will all be properly guided and strongly motivated to reach out to our constituents at the grassroots level. The strategic significance of contact tracing cannot be overstated. One successfully identified, isolated, and treated COVID-19 positive person could break the chain of transmission to tens or hundreds of vulnerable people in the community. On the aggregate level, this will help save the economy and the government from collapse. Following Secretary Año's marching order, each and every one of you is now a modern-day warrior in this new raging battle against an invisible enemy. You have a tremendous role to play in turning the tide of war, preventing the further spread of COVID-19, and flattening the curve so that we may all heal as one. The survival and well-being of our families and loved ones now rest in your hands. Thank you, and more power.